my name is Chelsea. I'll be doing your exam today, and today I have the pleasure of meeting Michelle. Nice to meet you, Michelle. So today we're going to go ahead and we are going to examine your head, your eyes, your ears, nose, throat, as well as your heart and your lung sounds. Do you have any questions or concerns before we get started today? No? Okay. So first I'm just going to be inspecting your face, and it looks like eyes are symmetrical, nose symmetrical for the most part, deviates a little to the left. And can you go ahead and smile for me? And can you frown? Can you puff your cheeks out? Don't let me. Okay, perfect. So cranial nerve 7 is intact. And then I will have you go ahead and can you kind of clench your teeth for me? Okay, 5 as well. And now I'm going to just inspect your scalp. If you could just put your head forward a little bit. And any head trauma and or brain surgeries in your life? No. Okay. Okay, go ahead and put your head up. Thank you. And hair is fine. It looks like it is also distributed evenly throughout the skull. And do you dye your hair? Yes. Okay. All right. So next, I'm just going to be feeling for your temporal arteries here. I'm just going to go ahead and take a listen. No worries noted, which is normal. So I'm just going to put my hands here. Go ahead and open your jaw for me. And close. And open one more time. And close. And clench. Perfect. Cranial 5 is intact. Now what I'm going to go ahead and do is I'm going to have you, I'm going to test your range of motion of your neck. So go ahead and put chin to chest and upward toward the sky. And bring it back normal, and then side to side, and then ear to shoulder and other ear to shoulder. Any problems with, nope, anything? Okay. Range of motion, cervical spine is noted as normal. And then what I'll have you do is I'll have you go ahead and swallow for me. Okay. And if you could go ahead and just take a small sip of this water and swallow. Okay. And then one more time. Okay, thank you very much. So thyroid rises and falls appropriately with swallowing. So I'm just going to feel here. Let me know if you have any pain. Okay, so trachea is felt midline. And no tug noted, tracheal tug. So what I'm going to do is I'm just going to assess your thyroid from behind. So go ahead, put a little bit of water in the back of your throat. Go ahead and swallow when I instruct you to. Okay, go ahead and swallow. Okay, and sing. Okay, and one more time for me. So the isthmus of the thyroid noted, as well as both left lobe and right lobe of the thyroid. So what I'm going to do is I'm just going to palpate your lymph nodes of your head. So occipital, postauricular, periauricular, tonsillar, retropharyngeal, my parotid, submandibular, and submental. Now I'm just going to feel for the movement in your neck. So my anterior and posterior and my deep posterior. And now I'm just going to bring this down a little bit. I'm going to feel your clavicles. So if you could just go ahead and pull your sports bra off to one side for me. Thank you. Take a deep breath in. Okay, other side. Palpating supraclavicular nodes and no nodes palpated, which is a normal finding. From here, I'm going to have you go ahead and pull your gown up for me. Thank you. And then I'm going to have you shrug your shoulders. Perfect. Back down. And shrug against my resistance. Okay. And then head against my resistance. Okay. And then head against my resistance. Okay. Great. And now I'm just going to feel for your carotids. Okay. And that was cranial nerve. 11 is intact. Okay, so I'm going to go ahead and just look at your carotids one at a time here. Okay, I'm just going to take a quick listen. So no brewery noted, which is a normal finding. Next, we're going to go ahead and move on to your eye exam. So I do not see any edema as I am looking currently. Can you go ahead and close your eyes for me, normal? And no lid lag noted. Eyes are covered completely with closing of the eyes. Go ahead and open up your eyes for me. And can you raise your eyebrows? Okay, and can you close your eyes really, really hard? Okay, and open again. Okay, perfect. So cranial nerve 7 is intact. Now what I'm going to have you do is I'm just going to have you close your eyes. I'm just going to kind of push on your. Any pain? Nope. Okay. Okay. And no resistance met with palpation. I'm going to go ahead and look inside of your eyes. So I'm first going to have you look up for me. So conjunctiva is pink. No abnormalities, no lesions. Lacrimal duct is also pink and moist. And are you having any eye irritation? No? Okay. So I will not inspect upper. And conjunctiva is pink, no lesions noted, also moist. And the lacrimal duct, moist, pink as well. Okay, so now I'm just going to test for your sensitivity in what we call your cornea. I'm just going to touch this on your eye. Okay. Okay. Blinking noted, which is a normal finding, telling us that cranial nerve 5 is intact. Or I'm sorry, cranial nerve 5 and 7. So now what I'm going to go ahead and do is I'm just going to assist your pupils with the light. If at any time you need a break from the light, just let me know. I have already previously dimmed the lights, so normal lighting, and then I'm just going to dim it down to here so we can see you. So pupils appear round. They are equal in size. I would say between 2 to 3 millimeters in size currently. Color of the eyes also clear. I'm going to kind of check, just look straight ahead for me. Sclera is white, slight blood vessels noted, and other eyes, sclera mostly white, a few blood vessels noted as well. And it also looked like lenses were also clear. So then what I'm going to have you do is just look straight ahead for me. Okay, so left pupil constricts directly with right pupil constricting consensually, which is normal. And right constricting directly with left consensual. I'm just going to wait for pupils to go back to appropriate size. I'm just going to swing over your eyes. Okay, so pupils constrict bilaterally with the swing light test. Now what I'm going to have you do is just look past me. And then can you refocus your eyes on my finger? And pupils constrict bilaterally, showing me that accommodation is intact. Now what I'm going to do is I'm going to shine this bright light in your eyes. If you need a break, please let me know. At first what I want you to do is kind of look over my shoulder, and then when I ask you, please look into the light. So I'm first going to just put my hand on your shoulder for stability. Okay, so red reflex is noted. And go ahead and look into the light for me, please. disc noted, macula densa not seen or evaluated. Thank you, Jennifer. Okay. So I have my light set back to 0. I'm gonna go ahead and do the same thing on the side, okay? Okay, so red reflex is noted. Go ahead and look into the light for me. Okay. And optic disc is now visualized. And no macula densa seen on that eye as well, or either. So that's going to determine your cranial nerve 2 or the optic disc acuity, which is great, which is intact. So from there, what I'm going to have you do is I'm going to have you follow my finger. So keep your head straight, do not move your head, just your eyes. Same with this one. Okay, so cranial nerve 3, 4, and 6 are intact. I'm going to have you follow my fingers again. Okay, great. So with that followed appropriately, it looks like there was a little bit of nystagmus with both left movement as well as right movement. No nystagmus with upper or lower movement. So now moving on, I'm going to go ahead and I'm going to inspect your ears. They're equal bilaterally. When I move your hair here, I don't see any abnormalities on the outer aspect of the ear. As well as this ear, I don't see any abnormalities noted. Okay, so next what I'm going to do is I'm going to go ahead and I'm just going to take a look in your ears, okay? A mastoid does not appear abnormal. So I do have to pull your ear up and back when I look into your ear. If you have any pain with that, please let me know. I'm just gonna put your hair back if that's okay. And up and back. Okay, so there seems to be swelling in ear canal. The small portion of the tympanic membrane that I am able to visualize is pearly gray. I'm unable to see a cone of light, also unable to detect ossicles at this time. I'm going to assess this ear as well. And with this ear, tympanic membrane is a pearly gray. I am able to detect ossicles as well as the cone of light or light reflex, which is great. Next, what I'm going to be doing is I'm going to be conducting a whisper test. So I'm going to be testing the opposite ear that your finger is going to be in. So I would like you to place your right ear in your right finger. I want you to wiggle it as I whisper behind you, okay? And then I want you to go ahead and repeat back to me the numbers and or letters that I say. 5, 3. Okay, great. I'm going to do the other side now. 4, 2, 6. Great. So you gave me the correct responses, which tells me that your cranial nerve 8 is intact. Next, what I'm going to do is I'm going to hit this hammer-like thing, and I want you to tell me if you can feel this in both ears, your right ear, or your left ear. Okay? Mm-hmm. Okay. Next what I'm going to do is I'm going to do a similar test. I'm going to put it in the bone right behind your ear, and then I'm going to go ahead and I'm going to move it here. I want you to tell me when you can no longer hear it with it on your head, and then when you can no longer hear it outside of your ear, okay? I'll start with your left ear first. your opposite ear. So same thing. So with that finding, what we would want is we would want to be able to hear the air, or when it's outside of your ear, twice as long as when it's on your bone. Unfortunately, with that left ear, it looks like you're hearing it about the same time, so that would be an abnormal finding. As far as your right ear goes, it looked like, or it seemed like it was a little bit more than 2 times longer than on the bone, so that's a normal finding on your right ear. From there, what I'm going to go ahead and do is we're going to move on to your nose now. So like I had said earlier, nose is pretty much symmetric, just deviates off to the left ever so slightly. I'm going to go ahead and just kind of push on your nose here. And any pain with palpation? Okay. Any nose surgeries and or nose trauma in the past? No. Okay. I'm just going to look up into your nose here. So just tilt your head back slightly. Thank you. Turbinates appear non-swollen in that nostril. Septum is pink. All the mucosa is pink and moist. And then we're going to do the other one here. Okay. Again, turbinates not swollen. Can note septum is intact. No trauma to the septum. And it did not look like I saw any exudates or any pus drainage from your nostrils, which is great. Now I'm going to palpate your sinuses. So if you have any tenderness in your sinuses, please let me know. Any tenderness? And any tenderness. Okay. I'm going to clog your nostril here. Breathe. Okay, and next. Okay. Heard mostly bilaterally. A little more airflow on the right nostril than the left. So next we're going to go ahead and I'm just going to inspect your mouth. So have you had any mouth surgeries in the past and or any trauma to your mouth? Yes. Okay. What kind of surgeries have you had? Jaw surgery. Okay. Go ahead and open for me. I'm just going to kind of take a peek around here. So on first inspection, I see that the buccal mucosa is pink. It is moist. I am noting a possible lesion to the back left above the left lower, one of the left lower molars. Go ahead and stick your tongue out for me as far as you can. Great. So able to stick out tongue laterally, no deviation to the left or right. That is indicating that cranial nerve 12 is indeed intact. Go ahead and stick out your tongue for me and say ah, ah. Do it again, please. Okay, so uvula rises midline, and that's telling me that cranial nerve 9 is intact. Now what I'm going to do is I'm just going to put some gloves on. I'm going to go ahead and just kind of poke around and make sure everything feels okay. If I cause you any pain due to your past dental surgeries, please let me know. Okay. Okay, so what I want you to do is I want you to go ahead. I'm just going to put your tongue back in your mouth for me, please. Of note, there are 2 teeth missing bilaterally in the bottom jaw, but teeth no teeth appear to be loose at this time. I'm going to go ahead and just kind of feel around in your mouth. Lesion in back does not appear to wipe away with sweeping motion. Okay, tongue. just need you to pull tongue out, please. Nope, forward, please. Thank you. I'm just gonna kind of look at the sides here. So no abnormal findings in your mouth, just that one little lesion on the back left of your cheek, which appears to be red. Next, what I am going to do is, okay, so I do need you to read to me the letters that you see. So I'll have you first, we're gonna kind of backtrack here, I apologize, I'm gonna cover your eye. Go ahead and read the smallest letters that you can read clearly.
LTFPH.
Great, and can you go ahead and cover your other eye? And again.
HPFTL.
Okay, great, thank you so much. Okay. So now what I'm going to do is I'm going to go ahead and we're going to move forward and inspect your lungs.
I'm gonna touch my teeth. Tongue to my mouth.
And then tip of tongue to your teeth, and then go ahead out again, and I'm just gonna test your gag reflexes here. Okay. Sorry.
What's work?
And gag reflexes are intact. So now I'm gonna go ahead and we are gonna move on to your lungs.
Okay.
So I'm gonna have you go ahead and pull your gown down. And what I'm first going to do is I'm just gonna kind of inspect with my light. I'm just gonna stay seated for me. I'm just gonna watch the rise of your chest here. I'm just gonna kind of feel, so I'm gonna put this away. Okay, so rise of chest interiorly is symmetrical. Okay, I also see symmetrical rise posteriorly. So I'm gonna feel, I'm just gonna have you go ahead and just take some normal breaths for me, okay? Okay. Great. And then I'm just gonna kind of butterfly my hands over. Go ahead and take a big deep breath for me. Okay. Rise is symmetrical in the front with expiration. Inspiration, go ahead and take a deep breath. 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 And breath. Good. I'm gonna check back here now. Go ahead, big deep breath for me. And exhale. Okay. And rise is symmetrical. So now what I'm going to go ahead and do, and I'm going to have you say 99 as I place my hands over your chest.
99. 99. 99. 99. 99. 99.
One more.
99.
Okay. Next, what I'm going to do is I'm just going to check for what's called CVA tenderness. So I'm just going to place my hand here. I'm just going to kind of do a thud. Any pain?
No.
Okay. Any pain?
No.
Okay, great. Next, I'm just going to percuss here. gonna listen. So, breath for me. And breath. Okay, and hands overhead for me. Okay, and stop. And one more big deep breath. Okay, great. Now I'm gonna have you do is I'm gonna have you go ahead and lay back. Just gonna have to go deep with your heart here. And as I'm doing this, I'm just gonna go ahead and pull up your head. And I'm just gonna first feel for the point of maximal impulse, which is at the fifth intercostal space and midclavicular vein. Then what I'm gonna do is I'm gonna feel for a thrill or a heave over the base of your heart, which is not palpable. And then I'm just going to have you turn your head to the left and feel the carotid at the same time. Okay, I'm gonna have you go ahead and take a seat up. I'm just gonna listen to your heart, okay? So the aortic, a pulmonic, the second pulmonic, the tricuspid, and the mitral. And I'm just gonna listen with the other side of my stethoscope. So aortic, pulmonic, second pulmonic, tricuspid, and apex mitral. Okay, next I'm gonna have you lay down. I'm just gonna go ahead and listen again for any extra heart sounds. And can you take a big deep breath and hold it? Okay, let it out. Close the mitral. Okay, and I'll have you go ahead and lay on your left side for me. Secondary pulmonic, tricuspid, and point of maximum impulse. Okay, great. I will have you go ahead and sit up. And that's going to conclude our exam for today. Do you have any questions or concerns? No, not today. Okay, you can go ahead and get dressed. Okay, and then you're free to leave after we're done. Okay.